And welcome back. Well, October is Breast Cancer Awareness Month, and it seems like we need every tool in the toolbox to find and detect this sometimes deadly disease.
Joining us now from ProActive Health with a non-invasive approach to assessing breast health is Dr. Joe Scovell. Welcome to the Morning Blend.
Thanks for
great
being
to be here. Thank you.
Let's talk a little bit about thermography, what it is and how you use it.
Sure. So my clinic is ProActive Health. At our clinic, we really look for alternative ways. We interest our patients in using alternative ways to really help them achieve optimal health. Now, that being said, we're looking at other imaging protocols to be able to do that as well. So we're looking at non-invasive, very effective imaging protocols to really give us the most information possible. And that's where thermography comes in. So thermographic imaging is basically looking at heat differentials that occur within the breast tissue that can be indicative of cancerous growth or even precancerous growth.
So would it show up as like a red on a graph, like a hotter spot? Okay.
Exactly right. Yep.
So when we look at
there's
this,
the image. Right. So on the left we have a normal breast tissue, normal breast tissue on the left. On the right we have that abnormal place on that left breast where we have all of this heat that's being entrapped in that area, and that's what we're going to be seeing on the thermographic image.
So I think oftentimes about the fact, you know, being in my 30s and you're supposed to wait until in your 40s to get a mammogram, and you hear, you know, all these people who, when they are diagnosed, it's in a later stage. I always feel like I wish I could do something earlier. So are there things, is this a benefit to younger women to getting a picture prior to doing a mammogram?
Absolutely. So our recommendation is you get your baseline thermogram between the ages of 20 and 30. Okay? So that's what we're looking at. And really the value of this is getting it done early and then having comparisons as we go along. So the subsequent images are compared to that baseline image where we feel like there's the, I guess I would say, the best breast health between that age of 20 and 30. So we can compare that to basically our best time in our life.
Can you still start in your 30s?
Absolutely. You can do this anytime. And again, it's all about that comparison, but it's amazing. When we look at these images earlier, the earlier we do it, really the better chance we have at catching it, especially as we're slowly analyzing subsequent images.
Yeah. Right, let's talk about something that people are very familiar with, especially if you're 40 and older and you have a regular mammogram. So there's the 2D mammogram that a lot of people are familiar with, more of the traditional or older way of taking a picture of the breast for radiologists. Then there's 3D mammogram that's supposed to give them a better look at it. How is this maybe different, or is it a way to kind of complement mammography? Right,
that's exactly right. So it's a complement to it. So the way that this is different, I think we have to explain a little bit of the process of cancer development. So the way that it's different is it's looking at physiological change that happens. So it's looking at this process called angiogenesis. So all tumors need energy, right? So they replicate very quickly, they turn over very rapidly, so they need a lot of blood flow and they need a lot of oxygen, nutrients to feed themselves. So what thermogram is looking at is it's looking at the increase in heat that occurs when we get more blood flow to the area, not the structural change. What that helps us do is it actually helps us see and interpret breast cancer development much earlier because we're looking at the physiological change that can happen 5 to 10 years actually before the structural change.
Okay.
So how does the process work? Someone comes to you and says, hey, I'm interested in getting this baseline?
Sure, exactly right. So this is a very simple process, takes 20 to 30 minutes.
Okay.
We send out everything by email, so we send out the history form. We also send out the pre-exam recommendations that we give 24 hours in advance. We send this out, the patient brings that in, they come into the clinic, they check in, we get them to the thermography room, it's a private suite, so it's very secluded, which is good. They take a seat, they actually accommodate for approximately 12 minutes in that room to get their temperature to the room temperature, or to get a baseline. So if you're coming in from Wisconsin winter, we don't want you taking the image right away.
Acclimate, right.
Exactly, and so that acclimation process is extremely important. Right after the examination, within 2 to 5 business days, we get a report back from our thermologist, Dr. Robert Kane, who is just an amazing guy. He's been doing this for 30 plus years. He is the guru of thermographic imaging interpretation. So we get that back, and then what we do is we send you the recommendations that he made, and we go from there.
That's great.
How often would someone, so a lot of people are familiar with the recommendation for a mammogram is every year.
Right.
How often should you visit a place like ProActive Health to have this thermal imaging?
Well, the great thing about this is a really important point to make. With thermography, there's no radiation and there's no breast compression, which I think is a big thing for women.
You don't squish the
You
breast?
don't squish the
That's awesome.
There's no clamping of the breast tissue, which is wonderful. I think a really huge point that I want to make about this, it's completely non-invasive. But yet we're getting a lot of really great usable information much earlier, and I think a very, very positive response from most women when they do get a thermogram.
That's great. I know this is an important month as well, with October being Breast Cancer Awareness Month. So you guys have a really great special right now, which is $50 off your first thermogram if you book it in October, because again, such an important month for us to pay attention to our bodies. Dr. Joe Scovell, you can contact him at 262-439-9822 at ProActive Health in Wisconsin. Their website is proactivewi.com for more information. So again, you got to do that in October to get that $50 off and mention the Morning Blend. Thanks so much for being here.
Thank you so much for having me. I really appreciate it.
Important
Really
discussion.
fascinating work that you're doing. Thank you so much.
Thank you, absolutely.